Maybe you've had a microdiscectomy recently or sometime in the past, or maybe you're about to have one. So what I'm going to do today is just summarize a blog I've recently written about measures you can take to prevent a recurrence. Well, firstly, if you're about to have a microdiscectomy, I'm a big believer in prehabilitation, measures you can take beforehand that can help prevent a recurrence. So if you think about it, your spine is made up of a stack of bones that sit on top of each other. Between each bone, you've got the discs, the cushions that protect the two bones and allow a couple of degrees of motion. What tends to happen is the muscles that surround the spine can weaken, and that tends to put more strain on the lining of the disc and the joints, and also certain postures we adopt in our jobs. If you sit at a desk for long hours and you slouch, that also puts strain on the linings of the disc, and they can tear and cause a slippage. If you're about to undergo surgery and that's been discussed with you as the best option, there are still measures you can take so that you get a better outcome afterwards, and there's good evidence to support that. And that's usually with your physiotherapist. Now, many of you might be in a lot of pain and you struggle to engage in the physiotherapy or exercises because of the pain. Well, a good physiotherapist should be able to tailor some of the exercises and stretches you can do to your ability. Other factors that come into play before and afterwards are weight. Patients obviously get tired of people telling them to try and lose weight. So you can't lose weight, you can't exercise when you're in a lot of pain, obviously. Again, there are measures or exercises that can be tailored to what you are able to do, but more importantly, I tend to work with with a few dietitians and nutritionists who can help with that as well. After the surgery, there are some basic exercises that you do as pain allows, and these are things that the physiotherapist normally give you on a sheet, which start off as some basic stretches, things like cat-cows, bridges, and then as time goes on, you should have the physiotherapy or the exercises tailored a bit towards you and what you're able to do as the back pain from the wound heals up. My view with these things is keep doing these for life. Make it part of your regular routine, because this is how, in general, you maintain a good back. And a big part of my practice, what I try and promote, is maintenance of a healthy spine. Thereafter, you can take up a class if you want, like Pilates, where you focus on core strength, or even work with a personal trainer to build up the core strength. Working on the core and improving its flexibility is really important. With your work, try and think about your workstation, especially a lot of the patients I see in the NHS and in the private sector. The majority are office workers. So think about your workstation, your chair. Is your back appropriately supported? I wrote another blog about the importance of posture. Sitting upright with the back arched backwards, your computer monitor, the center of it at eye level, having your desk at the appropriate level with your forearms. These are all important factors, and taking regular breaks from sitting just to walk around and have a little stretch. Using a standing desk can be helpful, but there is good evidence to say that standing for a long period of time as well doesn't really help the back or back pain. So alternating between sitting and standing is also really important as well. In the first few weeks after surgery, try and avoid heavy lifting or bending to lift stuff. You've got to adopt the right posture when you're bending. So trying to bend from the hips, but keeping your shoulders back as you do so, and drive the strength from the legs is really important. So these are some of the basic measures you can take. To summarise, maintain a healthy weight, practice good posture, exercise regularly, and be careful with lifting heavy objects, bending, adopting the right posture. If you're still in pain and you're not getting through it, obviously go back to the surgeon who did your procedure, discuss pain medications and get advice from them. So if you've got a recurrence of symptoms, specifically leg pain, things like that, it's important to go back to the surgeon who did your procedure, especially if it's very recent. A big part of my practice, or more and more patients I've seen recently, are patients who have had surgery quite a long time ago. A big part of my practice is revision surgery. So if you need advice, please contact us. I hope you find the blog helpful. If there's anything we can help with, get in touch with us through the number below and the email address. Thank you.